So the good news is that we appear to be past the third wave or the third peak of infections. But what's happening next is devastating. More hospital admissions and more deaths. Is this a pattern with COVID-19? Let's discuss this with Professor Francois Venter. He's the director of the health group eNCA at Wits University. Prof, thank you very much for your time. Now, of course, I think, South Africans got a scare when day before yesterday we recorded about 17,000 new infections and over 500 new deaths. It looked like we actually weren't over our peak, for instance, in Gauteng from 2,000 to 500. So help us understand what this is about. We attributed it to maybe more people testing now after the unrest went down. Are we understanding it clearly, or is this also just uncharted territory?
So some of the data is going to be messy because of the protests and, people's testing habits changing. We can see a dramatic decrease in the number of new infections in Gauteng, and most of the other provinces, with the exception of the Western Cape, the numbers seem to have either plateaued or on their way down. The problem is that, the hospitalization and the deaths come 2 to 3 weeks later, and that is where we're seeing, the health system under severe strain across the country.
Could the severe strain caused by people going 2 or 3 weeks later be caused by people who think they can heal from home and then realize much later that they're getting too sick?
We see that as an international phenomenon. It's not just in South Africa, where people are actually scared to go to facilities for good reason. The facilities at the moment are not the friendliest places to go to because of all the infection control measures there. And people often, myself, have had to nurse people at home, trying to prevent them from getting into hospital, particularly in places where here in Central Joburg, even a week ago, there was people were sitting in chairs waiting for beds to get to oxygen points. So we're seeing that strain across the country at the moment. So people will be trying to stay at home for as long as they can before they're absolutely in an emergency situation.
And what would be your advice, Prof? Is it advisable to stay at home until you get to that situation? I mean, we've heard, for instance, beds not being available. That's been a phenomenon in South Africa for a long time. COVID has highlighted it. But also, we've heard of oxygen possibly running out in some hospitals. So is it advisable to stay at home until you're at that point, or should you just go much earlier?
It's really hard. In an ideal situation, you really should be in touch with your healthcare practitioners, watching your oxygen saturations if you can, and get into hospital as soon as those saturations start falling. We have a lot to offer once you need oxygen. There's a lot of drugs and things that need to be initiated at that point. Before that point, it's very much just symptomatic. Sort of fluid, stay in bed, look after yourself, take some Panado or ibuprofen or something just to deal with the symptoms. But once you actually need the hospitalization, then you need serious drugs, and you usually will need oxygenation. Now, while you can get oxygen at home, there's a limit to what that concentration can be, and then you need to go to the hospitals. There have been reports from several hospitals of running out of oxygen, but I must say I think it's been the exception rather than the rule. So by and large, the oxygen supplies have been okay. The problem has been overwhelming beds, and as I said, Gauteng was in this terrible position a week or two ago where people were waiting for beds in many of the major hospitals. We're starting to see that happen in the Western Cape, and there are reports from some of the other provinces that the hospitals themselves, getting a bed is very, very hard. And I think that's why you're seeing the appeal from the Western Cape Department of Health, for instance, is just avoid trauma situations this weekend. Try not to be in an accident or anything else, because the hospitals are full of COVID patients. And that's certainly where Gauteng was 2 weeks ago, and where many of the other hospitals are at the moment.
And I guess also the reason why people are scared to go to the hospital is because maybe they have had, one of those emergency situations from an accident or some violent situation, and then you arrive at the emergency ward and you're in the same you're in the same room as people who potentially have COVID.
Yes, I think that is always scary. Is you don't. Having said that, most of the people actually pitching to hospital are far less infectious than they were a week before that. There's this, it does take about an average 2 weeks to hit the hospital, and by then most people have actually cleared the vast majority of the virus, if not all of it. So that's one silver lining if you are going to the casualty situation. The problem more is just the overwhelming of the healthcare facilities, and we should we should just be doing everything we can to protect the hospitals at the moment and the healthcare staff there that are trying to, often with very few resources, trying to deal with stuff. But what we saw certainly in the first and the second wave is a lot of people were scared to go for their diabetes meds, for their HIV meds, to just go to the local clinics because they were scared to contract COVID. And that actually is a legitimate fear. Although I must say, I think most of the hospitals and clinics have done a really good job in trying to physically distance, to open the windows, to make an effort to try and limit the exposure as much as they can.
So, Prof, just a quick one. We should expect that the numbers don't really go down as we expected, and even if they do, for the moment, hospital admissions and deaths might still stay a bit high.
Not a bit high. I think it's going to skyrocket. The numbers, I think we are going to see new infections going down now across the country, with the exception of the Western Cape, which looks like it still has to hit its plateau. The problem is the consequences of COVID, this follow-on. In fact, the death rates, when I was looking at the data this morning, looks like it's higher in almost every single province than in the first or the second wave. And in some of the provinces, 2 or 3 times higher than the second wave, which hit us so severely. So the next couple of weeks are going to be very bleak, I'm afraid. Now, I'm speaking for myself and for the people immediately around me, and probably for you and your viewers. It's the first time I've seen so many people I know die immediately. People I know, it's not just distant people, but a lot of people around me have died. And I think that we need to anticipate that August is going to be a pretty grim period for South Africa.
And is this because of the Delta variant? What's going on?
So the Delta variant is so much more infectious than the Beta variant that hit us in December. It's actually quite startling how much more transmissible it is. It's not necessarily more deadly. We haven't got good data yet to say that. And the virus has no interest in killing you. It just wants to transmit as effectively as quick as possible. And this Delta variant has got that right. So it's a lot of it is just the rise of this Delta variant. It's completely displaced the variant that hit us, the first original virus that hit us in June last year, and then the Beta variant that hits us in December. Almost every single case now is the Delta virus. And that just seems to be just that much more transmissible than the ones we've had before this.
So we have a bleak few months ahead. Thank you very much. That was Professor Francois Venter from the eNCA Health Grouping at the University of the Witwatersrand.